The reason I feel so engaged with the SynDaver lab is because it allows me to feel that I'm bringing beginning surgeons into a place where they have confidence, where they don't fear surgery, where their patients are likely to have better outcomes. If you come to the SynDaver lab, you'll be a better surgeon after than you are right now. You would be one of a group of 12 participants. There's 2 instructors, and my hope is that a lot of your time would be given to receiving meaningful feedback regarding ways that you could fine-tune your technique. The assumption would be that you already had surgical experience, but often what's very helpful is having some feedback from someone with a little more experience to say, adjust this, have you considered this movement, your posture can be tweaked, your tissue handling skills can be adjusted. And so we try and cover all the common gastrointestinal procedures, so gastrotomy, enterotomy, intestinal resection and anastomosis. We also cover cystotomy, with the focus being on removal of urinary bladder stones. We cover gastropexy. And I think surgeons are made, not born. No one begins as a good surgeon. You have to get there. To get there, you need to make errors. The SynDavers allow an arena in which those errors can be made without patient compromise. And that's really, for me, one of the wonderful things about this lab. And really the goal is to take you from reasonable confident to excellent.